Alright, so this will actually serve as our first video as related to what arteries or veins of the upper and the lower limb. So we are trying to talk about arteries and veins of the upper side of the body, and also arteries and veins of the lower side of the body. So this one is more of like an introductory video where we just get to look at them on a glance. Do you understand? We get to look at them on a glance and just look at their possible anatomies. So arteries and veins of the upper limb and the lower limb, just so you know, they actually form intricate networks that ensures that what the blood supply and taking bad blood away is efficient. Okay, so let's move. We'll start with the arteries of the upper limb. When we're done with them, we'll look at the veins of the upper limb. When we're done with them, we'll also look at the arteries of the lower limb, then also veins of the lower limb. So arteries of the upper limb, the first one which we have there, please, you are following this, so you could actually just pause and observe this. So you know, have the subclavian artery, have the axillary artery, have the brachial artery, have the radial and the ulnar arteries. Okay, so that's like from subclavian you go towards axillary, you go to brachial, you get to radial, you get to ulnar. Do you understand? It's just the same thing. So just so you know that they actually form a rich collateral circulation around the shoulder and the elbow, you know, the palmar arch and all of that. Just ensure that what the hand is receiving adequate, you know, blood supply all along. So how about the veins? If the arteries are basically supplying the arteries are supplying blood, okay, veins are actually taking the bad blood away, that have deoxygenated blood. So you should know that we have deep veins and we have the superficial veins. Okay, so deep veins, they just have the same name as these other arteries, so they run alongside. Like brachial artery now have brachial vein running alongside it. You know, you understand, it's just like that. So superficial veins, you have the cephalic vein, the basilic vein, the medial cubital vein. This is what the medial cubital vein. You have the cephalic vein, you have the basilic vein, you have the radial vein, and so on and so forth. You understand? So moving to the lower limb now, which is, you know, this is more of like a summary. The lower limb, this is a very nice image trying to show a summary of all the arteries and also the veins that lie along this. Okay, so in the lower limb we have the external iliac artery, we have the femoral artery, we have the popliteal artery, we have the anterior tibial artery, we have the posterior tibial artery. Okay, not really a comprehensive image, but you could actually get to, you know, understand a lot from it. So veins of the lower limb now, we have the femoral, we have the popliteal, we have the tibial veins. Femoral, you know, popliteal is around down here, but it's not recorded, you know. Then we have the great saphenous vein, we have the small saphenous vein. This is a great saphenous vein, this is the small saphenous vein. Okay, so just so you know that also have the perforating vein, and all of them is just all about taking, you know, bad blood, you know, from the downside, you know, to the upside and all of that. So this is what we got for the arteries and veins of the upper and also the lower limb anatomy.